watching NBC7 News at 6.
Tonight on the News at 6, we are beginning a special series called Breakdown. I'm Mark Mullen.
I'm Catherine Garcia. 1 in 3 people experienced a mental health issue this past year. That concerning new statistic comes from the National Alliance on Mental Illness. It was more than a year ago that I started investigating the breakdown in the mental health care system and the devastating impact that it's having on our community. That research took me inside police training, inside a jail, a homeless center, a courtroom. I also got to know families struggling to get care. Tonight, in this first episode of our special series Breakdown, you'll meet San Diegans who are telling their stories so others might not feel so alone.
Hi, my name is Lauren.
Hi, my name is Jack. My hobbies are basically draw, video games, like any regular child at this time anyway. I like to read a lot.
Jack is like one of the most special and unique human beings that I've ever met and I have like the greatest pleasure of being his mom. But we have dealt with a lot of mental health issues since he was a really young boy. And we're talking like 3, 4 is when things started to really like escalate as far as symptoms appearing that were a little concerning for a kid his age.
Jack has been diagnosed with ADHD and DMDD, disruptive mood dysregulation disorder.
He has a lot of trouble regulating his mood, and so he can go from 0 to 100. His brain will flip a switch, and it's like he's perfectly happy right now, but then his brain will flip, like something will happen, and he'll be in a fight or flight mode, and more often than not it's fight, which puts us both in situations we don't want to be in.
Being regular, I know that's not gonna happen, and I never do want that to happen. I know I'm not regular, but that's fine with me. I mean, it's just really frustrating for all these things to happen, and I have no control over it. And when I do try to control it, something always goes wrong.
His mother says his most recent mental health crisis ended with Jack at Rady Children's Hospital, where he waited days for a bed and the care he needed.
They just didn't have beds available, and there weren't any county beds available for him for 4 days. And so he was stuck in a room for a couple of those days on the floor of a room, and by himself for a majority of it due to COVID restrictions. And it was awful. It was absolutely a traumatic experience for him and for me.
It was really frustrating because there was nothing I could do.
And their experience is not isolated either. Our investigation found in the past 8 years, behavioral health visits to the emergency department here at Rady Children's Hospital have gone up 1,700%. That is a lot of kids in need of care. Lauren doesn't blame Rady's. She blames the entire system. A spokesperson for Rady's told us our region and our nation are facing an escalating mental health crisis with our young people that can push existing resources to their limits. Rady Children's is urgently addressing the situation by investing in our dedicated psychiatric emergency department and our inpatient mental and behavioral health unit.
I don't want to cry in the shower anymore.
Lauren's fight to get Jack proper care has only become even more difficult because of the pandemic. Being a musician hasn't exactly been easy. That's been tough during the past year, hasn't it?
Absolutely. Yeah, when the shutdown happened, I lost all my work, everything for the whole year.
Lauren says without generous donations from her music community, she would not be able to afford the insurance copays, medication, and therapy that Jack needs.
It all comes down to money. And if you don't have it, you're kind of screwed.
This is her last school picture.
Clarissa and her family learned that difficult lesson trying to help her fraternal twin sister, Chloe.
I've always been super shy and to myself and just an introvert, and she was always very outgoing and in the party scene.
But the sisters did share one thing, a tough childhood, including a traumatic period of time in foster care. Clarissa's convinced that contributed to her sister's mental health challenges.
And her good times were so lovable. She was goofy and so outgoing and just the life of the party. She just loved everything and everyone. And then her bad days, she was really just struggling.
The twins' mom had a job with health insurance, but even then, they say finding and managing Chloe's care was extremely difficult.
My mom missed work, so she couldn't help pick up the bills a lot. She's also frustrated that she's running out of resources to help my sister.
The family says they could never get one-on-one counseling through their health insurance.
They prioritize physical well-being over mental because it's something that's physical. We can see it. We know it needs to be treated immediately. They're gushing blood, but we can't see somebody's mental state.
And I would say to myself, why does this happen to me? I can't imagine any other kid out there feeling what I'm feeling, and it just was very unfortunate.
At an early age, Angel Solis was diagnosed with ADHD and OCD, but parents Gabby and Miguel Solis say things got really bad when their son went to middle school.
We was every single day, everybody's crying in the house because we saw him suffering. When he came, he hiding under the table. He don't want to see anybody. He screamed. He refuses to go to school.
They say Angel was being bullied and nobody seemed to be able to help. So in desperation, they brought Angel here.
We're at the San Diego Center for Children. Actually, we are the oldest nonprofit serving the needs of children and youth in San Diego. Moises Baron, I'm president and CEO of the San Diego Center for Children.
What happens here?
So we provide a range of therapeutic and educational services for children and youth with mental, emotional, and behavioral disorders.
How many children need your help?
Data suggests that about 20 to 25% of youth may experience a mental, emotional, behavioral disorder. So that's a very significant number of youth in our community. And our concern is also that data also indicates that about 80% of them are not getting the help they need when they need it.
When you're a child, you're developing, your brain is developing, and those times are most important, If you don't get what you need then, you'll be lost by the time you're 18, and so it's really important for you to be able to get that support that you need, and when it's not there, it completely messes up how you feel, your emotions, and just how you perceive things.
How serious of a situation is this right now? If you could tell people, if you could shake them by the shoulders and try and make them understand, what would you say?
I think that we need to understand that we're really experiencing a crisis.
Clarissa and her family have seen what can happen because of a breakdown in the mental health care system. In 2014, Clarissa was called home during the middle of the school day.
I saw the cop cars, so I knew now I had something to do with my sister, but I figured she just had another outburst and she was going to jail for real this time. But then I see my mom, and my mom was crying, and then right as I was walking up to my mom, she just started crying. And she just said, I failed her. I'm sorry, I failed her.
After Chloe died by suicide, her mother joined other families in a lawsuit against their healthcare provider, Kaiser Health. Chloe's mother felt Kaiser was responsible for her daughter's lack of care. While the case was dismissed, it is now slowly making its way through the appeals process. Kaiser told us, in part, we remain deeply sympathetic to the loss that the Spivey family has experienced. The allegations in this case have been reviewed extensively, and there is no substantiation that this tragic event was the result of inadequate access to mental health services. We remain deeply committed to providing timely access to care. Meanwhile, Clarissa hopes sharing her sister's story might help at least one family going through something similar.
The best advice that I could give anybody is to just fight. If you know that something is not right, and if you know that somebody is having a hard time, don't allow them to ignore it just when they have their easy days, because their hard days hit them and they feel so alone.
Now, it is extremely difficult to navigate these systems. Here in California, almost half of families have private insurance. Half get Medi-Cal coverage from the state, and only the most serious cases get specialty mental health care from the county. Now, in all of these systems, there are different levels and kinds of care, and there are big gaps in all of them. What would you say to a family struggling that has a child struggling with mental health issues? What would be your advice to them?
The first thing is whenever they identify any behaviors that are a concern, parents need to trust themselves and trust their instincts. And if they think that their child is suffering, having a hard time, not doing well in school, or compare with the siblings or other peers not doing as well, to take that seriously.
He's a beautiful soul, and I'm so proud of him that he's doing a lot of stuff.
Angel's mom, Gabby, wants to speak openly about their challenges so others won't feel alone with these struggles. So does Jack's mom, Lauren.
I truly believe that the stigma itself is the reason why we don't have the services we have. People are afraid to talk about it. People are afraid to speak up. People are afraid to say, hey, we need this. We need this really bad.
There are, of course, so many families like the ones who spoke to us, and there are also people struggling in the open, but maybe we choose to look away. Coming up tomorrow, we'll explore how the breakdown in mental health care is deeply connected to our homeless crisis and is also having a huge impact on our jails and law enforcement.
What a remarkable story, Catherine. I'm still just, I can't believe one of the statistics that you shared in this, that at ER Hospital at Rady Children's, that they have had, what, 1,700% increase in psych visits in the last 8 years? Why?
I know, it's a huge question that everybody wants to know the answer to. And here's the thing, I asked every expert we interviewed for this series, and nobody had really a definitive, concrete answer. I mean, they mentioned the things that you would guess, right? Social media, cyberbullying, certainly in the last year, all of the isolation that came because of the pandemic and virtual learning. But there was no one answer, which makes it so difficult. Here's one thing, though, that the experts definitely all agree on. They say that early intervention is super, super important. The thing is, about 50% of mental health issues manifest by the time somebody's 14 years old. So they say if we can get to those young people at the very beginning when these symptoms start to show up, that can really help things from escalating and going into crisis mode. So that is a big priority and something that simply is not happening. By the way, if you'd like to watch the entire series after it airs here on NBC7, and for a guide of resources, we invite you to head to NBC7.com/breakdown.